You write a lot about the connection between the gut and the brain. Can you explain some of the things you've learned about the importance of that connection?
Yeah, absolutely. So I don't know if it's just me and if I forgot or if I did learn about it in my training, but until I studied functional medicine, I think I hadn't fully appreciated or been conscious of the fact that the vast majority of our neurotransmitters reside in our gut. And it's our gut bacteria that manufacture the neurotransmitters. And so it goes to follow that our gut health is absolutely paramount for our mental health. And don't get me wrong, I don't think everything to do with mental health is about neurotransmitters. I think they're only one small piece of the puzzle. But you know, a huge interest of mine as well is leaky gut and intestinal permeability. And my personal view is that I don't think gluten is good for anybody, full stop. But it's absolutely fascinating to know that when you eat gluten, that directly causes leaky gut. So it opens up the junctions between, you know, like the tight junctions between your gut cells and your gut wall, and then lets different toxins pass through into your bloodstream that can have all sorts of detrimental effects at sites distant in your body. And then the other aspect of it is that there's a clear gut-brain connection. So there's a hardwired connection along the terms of your vagus nerve, but there's also bidirectional communication that happens along different kind of immune pathways and hormonal pathways and different signaling that goes back and forth between the gut and the brain, and one influences the other and vice versa. Which I think is really fascinating when you talk about having a gut instinct or a gut feeling about something. You know, where does that come from? It all starts to make a lot of sense.
Yeah, I think that bidirectional signal is so important to understand. And like literally the gut is the second brain
Yes.
of a human. That connection is so powerful.
Yeah, absolutely. And I'm just fascinated by the gut because I think there's so much we don't know. And I think, you know, science is going to advance in the future and we're going to start to learn more and more about the microbiome. But I think what we know at the moment is just a tiny fraction of what probably actually goes on in there. And, you know, there've been some interesting studies showing some benefit with probiotics for some groups of patients, but I think there's a lot of misinformation out there. And, you know, in terms of having to have a wide variety of fiber and fruits and vegetables in your diet and eat the rainbow to have a good microbiome. I've got a good friend who works in functional medicine, and they've told me quite conclusively that the best microbiome testing results they've had are on carnivore patients that they have, which is really fascinating. But then I don't know that we really know what an optimal microbiome is. And even with the testing, I'm pretty sure you get shifts in the different bacterial populations according to time of day. And then you get into circadian rhythms and just everything's all just interconnected in the body.
Yeah, I definitely tell people, like, if you run into somebody who says they know something about the microbiome, run away, because they probably don't. It is so complicated and complex. And the more we learn about it, the more we learn about, yeah, it's almost like blood work, where like different times of day are going to give you different results. And it's so challenging and complex to really understand. This would maybe be a really great time, since you mentioned carnivore diets, to go back and talk about your personal story. You at some point recognized that you were a sugar addict, excuse me.
Yeah.
So what was your personal nutrition journey like? When did you start to find low carb? Did that, you know, go straight into a ketogenic diet? Did that go into a carnivore diet? Like, tell us a little bit about you and your personal history with diets.
Yeah, sure. I'm happy to talk about this. Yeah, so I've got into low carb probably about 20 years ago when Atkins was all the rage. And I kind of dabbled with it on and off, but I struggled to maintain low carb in the form of Atkins all those years ago, because I was still including some, you know, Atkins bars and artificially sweetened items of confectionery in my diet, and that always derailed me. And I remember having very intense cravings for sugar and doing really well some days with Atkins and having a really clean diet and not including any kind of processed stuff, and then just giving in to overwhelming cravings for sugar and just not being able to manage it. And so I think I was roughly low carb, but I wouldn't have been low carb to the extent of being keto for quite a number of years. But then went through a kind of training program that was looking more at intuitive eating. And for quite a long time, I felt like I had an emotional eating issue. And that was the only thing I could think of. And I hadn't fully realized it was actually a sugar addiction. So I've read every single book that there is on emotional eating. I remember doing a course here that talked about being your own guru. So, you know, testing out your N of one and doing what works for you. But they used to encourage having more food that you could possibly eat in the house, of stuff that you might be potentially prone to binging on or overeating. I think to show you that, you know, you can always have more of that, so you don't need to overeat it now. And, you know, when I look back at that now, you know, for a while it helped a bit, and it was all about making sure you were truly hungry before you ate. And I think the intuitive eating side of things is a really positive thing, but I think some of the message in there was wrong, particularly in relation to food addiction. And then I went through my biggest regret, but a vegan stint against my better judgment. And that was, when was that? I don't know, maybe 12 years ago now, something like that. And I was vegan for about a year, maybe a year and a half at the most. And I remember my dad saying, "Oh, it's just a phase, she'll grow out of it." And then that made me persist with it for even longer than I probably would have, just to prove him wrong. But that was really detrimental to me in terms of just my body composition and kind of losing muscle and just putting down a bit more fat, and my immune health. That's the only time I've ever had flu and been quite unwell with it. And other things like skin, like hair and nails and other things definitely suffered then. And then I came out of that after I had flu, lost my appetite for about 2, maybe 3 weeks, and I just could not eat anything.
Wow.
And it was a tuna sandwich that was the first thing I actually wanted to eat, and that's what got me out of being a vegan. And then, you know, I've been a huge fan of Mark Sisson for years, so read pretty much all of his books and followed Mark's Daily Apple for a long time, and then that got me into the more ancestral health principles and thinking about epigenetics and barefoot shoes and all sorts of stuff. And so yeah, I was kind of primal for quite a number of years before. I think about 6 years ago, I decided to go properly keto just because of some health issues in the family, and I kind of knew at that point that's probably the best way to go anyway. Why am I kind of sitting in this halfway house of slightly higher carb intake but still low carb overall? And it was a keto influencer, so Vanessa Spina, or Ketogenic Girl, who I really respect her opinions on the science, and I think she does a really great job. But I think she was trying a carnivore approach at one point in time, and that's how I first heard of carnivore, because I'd never come across it before she did that. And I remember thinking, that's absolutely crazy, what is she doing? And then I thought, well, I trust Vanessa's judgment on other things, so maybe I should find out more about this. And so I went online and I watched Michaela Peterson tell her story at CarnivoryCon on YouTube, and then I listened to Sean Baker speak at CarnivoryCon as well about just the defunct state of nutritional research, really, and epidemiology, and that was it. I watched those two things and I thought, I'm going to try this just out of curiosity, really. So that's why I tried it. And I didn't really have any major health issues, or I didn't think I had at that time, and it was carnivore that really clarified for me, as clear as day, just the extent of my sugar addiction all those years. So keto had improved it, but I still had a couple of niggly issues with things like dark chocolate and nut butter. So still felt a little bit more compulsive around those foods, or just ended up snacking on those things when I probably didn't really need to be snacking. So carnivore just made everything so obvious and so easy for me, just at a level of satiety that I've never really experienced in my life before, and then made fasting so much easier to do. And I'd been like making myself fast before, just intermittent fasting, nothing, no kind of really long fasts, but everything just became really easy and straightforward with carnivore, and it completely got rid of any food preoccupation whatsoever.
That's amazing. Yeah, that's amazing. I'm so grateful for somebody like Mark Sisson and Brad Kearns and these guys who, they basically created the primal space. Lots of nuts and seeds, lots of the big ass salads you would eat every lunch.
Yeah.
Had one every single day. And they were willing to learn and change their opinion on things. I remember when the book, The Keto Reset Diet, came out, like, wow, these guys are talking about keto. Interesting. It was kind of like a newer thing and maybe like a little bit controversial at the time. And everybody was calling it a fad. I thought it was a wonderful book that they wrote. And then they started to get more into the carnivore world and they talked about that. And it was like, wow, like if Mark Sisson doesn't eat his big ass salad every day, maybe I don't need to eat a big ass salad either. And it's a story that we hear so consistently. I was not feeling great. I was addicted on sugar. I started to pay attention to diet. Somewhere on the spectrum, I was either paleo or vegan or vegetarian, got a little better, but I had other health issues. I found keto. That was better. I certainly went in the better direction, but it was only when I went carnivore that everything resolved. All the weird stuff, all the subtle things, all the things that you think back on that you'd forgotten about, like aches and pains and all kinds of crazy stuff gets better. How long have you been on a carnivore diet?
So it's over 3.5 years now. So it'll be 4 years kind of in the summer this year. So between 3 and 4.
Okay, so almost exactly the same amount of time that I've been on. I started my 30-day trial of the carnivore diet in April of 2019. Okay. I loved it, so I never stopped. And so you're about the same.
It was July 2019.
There you go.
I remember we'd gone on holiday, and I think we were in Spain at the time, and we were staying in a hotel that was just it was great. So it was like buffet restaurant, and they had grilled meat every night. And I remember going up and it just messes with your head, I think, in the beginning, because you think, can I really not put any vegetables on my plate? And I remember I had a couple of mushrooms for a couple of days, like just measly mushrooms at the side of this plate of meat. And then I just ditched them, and it was on that holiday. So I always remember kind of what month it was I started carnivore. Yeah.
That's fantastic. Cool memories. What surprised you about your mental health after going carnivore?
Yeah, so I'm not somebody who's had kind of really any major mental health problems, but what I would say is I've probably been prone to a little bit of social anxiety. Like I'm an introvert by nature, more of an introvert than an extrovert, but I kind of that's just melted away and doesn't really cause me much of an issue, if at all, now. And I kind of care less about what other people think of me. That's something I was talking to someone about recently, but that's been a really nice perk to it. And the 0 carb Zen that people refer to, I didn't really have a mood difficulty before, but I get days where I just can't really describe the sense of optimism and excitement that I feel for whatever is going on in my life at the time. And that's a definite change. And of course, I don't suffer with anything like PMS anymore, like I used to. So I think that did get better over the years with low carb, but it definitely has been problematic in the past. So there's definitely mood effects that I've noticed.
Yeah. Wow. I mean, you described it almost identical to the way that I describe it. Like now in hindsight, looking back, like, yeah, I dealt with things. It wasn't to the extent that I would have been diagnosed with anything, but the anxiety or stressful events in life, the little things that shouldn't bother you, they bother you. People cut you off in traffic. You get very upset. And like, all of that stuff just tends to kind of go away, where you don't really mind those kinds of things happening. You're more grateful and more present for your life. And that's a really great way to describe it. I love how you said just like this, for no reason, there's just like a wave of optimism. I get those all the time, and it's wonderful. Yeah. It's so different.
Yeah, it's great, isn't it? I think I had one this morning, and then I was just reflecting on it, like, oh, there it is again. Isn't this great? Yeah. So I mean, if that can happen for people like us, I just, you just have to wonder what the potential is for people who have really struggled with mood and anxiety symptoms and any other sort of mental health symptom that can come. So yeah, I'm really excited, and particularly excited about carnivore, just in terms of the benefit and the potential for benefit of that for people's mental health, because it's a subset of keto. I don't know if you saw it, but there was a really interesting podcast by Dr. Paul Mason this week, and he was talking about, I think it was called "Is Your Cardiologist a Clot?" and in his usual kind of humorous way, but he was talking about atherosclerosis and the formation of cardiovascular disease and talking about blood clotting in relation to that. And oh gosh, why did I bring this up? I think it's gone out of my head now. Oh, anyway, it's something that you have to watch. Oh yeah, that was the reason. So he eventually came on to plant sterols, and a theory that, well, not a theory, there's evidence that plant sterols can integrate into your red blood cell membranes and end up causing dysfunction potentially. And they found red blood cells within atherosclerotic plaques. And then there are certain crystal depositions you get within heart disease plaques that were always assumed to have been cholesterol. But what he was putting forward was that plant sterols are actually almost identical to cholesterol. And he was putting the theory out there that perhaps it's plant sterols that are responsible for these crystallized structures within atherosclerotic plaques. And that sort of stuff just makes me so excited, I can't explain. And so he was coming on to say he's not even all that sure about coconut oil now. So coconut oil is something that, with a ketogenic diet, we would sometimes recommend to people to boost their ketone levels because of the medium chain triglycerides. And I've had a couple of people contact me or ask, would I recommend that? And I've had to say possibly, so it can be a good way to boost your ketone levels. But actually, I was aware in animal studies that, coming back to the gut again, that there's evidence that coconut oil in animals can lead to lipopolysaccharide endotoxemia, so LPS from gram-negative bacteria in your gut leaking across the gut wall and then contributing to inflammatory reactions elsewhere in the body because there's these toxins from the bacteria that can get elsewhere in your body. And then somebody sent me a link to Judy Cho's podcast from a couple of years ago when she had an expert on talking. It was just a 4-minute clip, and that's what they were talking about. They were talking about their concerns about coconut oil in relation to LPS endotoxemia. And I thought, oh, hang on a minute. So sometimes when people have asked me, I've said, well, I'm just aware of this concern in animals. So I'm not entirely sure if coconut oil is absolutely ideal for humans. And then there was Paul Mason this week saying he's actually veered away from recommending it because it's very rich in plant sterols. And with all the other evidence he's gathered, he's not all that convinced that plant sterols are healthy.
You're blowing my mind. You're blowing my mind. Again, I've done carnivore for 4 years. We talk to experts all over the world, but I still consider some foods like safer and beneficial. And coconut oil would absolutely be one. MCT oil would absolutely be one. Avocados for some people might be one. Maybe some seasonal fruit some of the time. That's bonkers. I have not heard any of that, and that is absolutely fascinating. I cannot wait to listen to that episode.
Yeah, go and watch this episode. I mean, this is my most exciting thing that's happened to me this week. It's only midweek, aren't we? So yeah, I mean, it blew my mind. And then I thought, okay, I'm gonna have to look into that more. So yeah, the more I do carnivore and the more that I find out, the more I start to think, maybe some of the experts out there who do seem a bit dogmatic about things, although I generally trust their opinion, but maybe they are actually right in terms of having some sort of caution over some of these plant foods, even if it is something like coconut oil that seemed seemingly unproblematic. I'm not so confident about that now. So
that is fascinating. Yeah. Wow, that's fascinating. I mean, we've talked to people like Dr. Mary Newport, who helped her husband who had Alzheimer's by feeding him coconut oil, and there was some pretty clear benefit there. But yeah. It's like I get asked all the time about, is this plant food okay in my diet? Can I have this sometimes? Can I eat this? And it's like, there's always a question. There's always a question. Yeah. It's never like a direct yes or no. It's always like I don't know, maybe it might be okay for you. It might absolutely not be okay for you. All plants have toxins.
Yeah, I agree. And that's where I'm at now with it as well. So I did have someone on social media recently asking me specifically about coconut oil, and that's partly why this reason came up. And I started off by saying, I think it's probably okay, but I'm just aware of this particular issue to do with the gut. And now by the end of mid this week, after seeing Paul Mason, I think I'm more saying I really don't know. And there might be a useful role for boosting ketones in a particular person if you really need to target your ketone levels for any reason. But whether that's ideal longer term, I think we just don't know, do we? So
We just don't know. We just
no.
don't know. Wow. Well, you just blow my mind. That is absolutely crazy. And you've already mentioned some of the harms of plants, but it's so interesting that the carnivore diet it works in two kind of different but similar ways. You're getting the food that is the absolute safest, most nutrient dense food that you could possibly eat, and you're eliminating all of the question marks. If you're eating all meat, you have no plants, you don't need to mess around with any of that. Like the person that was going back and forth with me on YouTube about how many oxalates are in blueberries, and I share my number, and he says, well, I heard it was this number. And the whole time I'm thinking, like, well, screw the whole thing. Don't have any plants. You won't have to worry about whether they have 20 or 60 or whatever. You wouldn't know that anyway. It's so interesting to find a diet that is actively beneficial because you're eating meat, and it is not actively detrimental because of all of the harms and crap that we find in plants.
Mhm. Absolutely. Like, so going back a couple of years, I never would have believed that coffee could be really harmful. And I know lots of people still include coffee in their carnivore diets. And I gave up for a while because it elevates my triglycerides. So I'm one of those people where it does push my triglyceride levels up. So after I found that, I thought, yeah, it's not ideal. I need to just stop drinking this. And then after a while, it crept back in a bit. And every so often I'll have a decaf coffee, but somewhere, if we're out somewhere and I think it's going to be good quality coffee, because I do worry about the mycotoxins and other compounds and components that are in coffee. But it was something particularly that Anthony Chaffee said, and an example he gave in one of his podcasts, where I think it was in the workplace, and a drug rep or somebody had come and visited, and he'd done a really hard workout one day with a colleague. And then the next day, the guy said, I'm going to be really sore the next day. And the next day he came into work and he was absolutely fine. And Anthony had said to him, yeah, that's because of the carnivore diet. And then a drug rep came in and offered coffee, and this guy had a coffee. And then within a couple of hours, he was aching all over. And when I heard that story, I wouldn't have believed it, but I've had my own experience of the occasional coffee, if I go back to it, and having wrist pain that I've never had in my life. And I've had that on 2 separate occasions now. With coffee from different places, kind of months apart. And then just other times, even if it's a decaf, feeling afterwards, yeah, I just shouldn't have done that because I just feel a bit off, or my stomach hurts a little bit, or, it's not really done me any favors. So I think carnivore is a great way of eliminating things and being able to really pinpoint foods or drinks like coffee that can really be problematic for you as an individual.